Okay, so did you know that you could look into your eyes and see that there is something majorly wrong? We're talking about diabetes, high cholesterol. Set aside cataracts and glaucoma, some other issues that are going on in your body too. And we're so happy to have Dr. Starla Fitch here, an eyelid surgeon. And you could almost see into someone's body and see which conditions are bothering them at that moment. It's really remarkable. Who would have thought our eyes could tell you so much, right?
Exactly, Michelle. It's funny because people think if you don't need eyeglasses, then you don't need an eye doctor, and that's so incorrect. Because a friend of mine was diagnosed with a brain tumor at her eye doctor's. Another friend, his mother was diagnosed with pancreatic cancer at her eye doctor's. It's crazy the things that we can see. So it's really important to kind of look.
To go for those checkups.
Absolutely.
And briefly tell me, if you're over the age of 40, how often should you see your eye doctor?
That's a great question. Let's pretend like you have no issues, like no diabetes, no high blood pressure. You should have a baseline screening at the age of 40, and then every 2 years for sure. If there's something else in your history, like family history of, you hear about macular degeneration, which is very serious, or a history of glaucoma, you're 8 times more likely to have issues if that's in your family. So you need to be seen more frequently.
Okay, so let's start off with our conditions. So first off, we were talking about high blood pressure, high cholesterol rather. So what are you looking for when you do an exam and you see high cholesterol?
Yeah, in high cholesterol, I put on these really fancy glasses that are like magnifying glasses, and I have like about 5 times the magnification. It's like loupes. You can also check your jewelry and see if it's really, if your husband really gave you the good diamond.
Is it really that diamond?
Yeah, exactly. and what you see are these fatty deposits on the lid that look like kind of yellow globular. And
like what we're seeing right now.
Yeah, here we go. Yeah, you see those little fatty globular deposits. Those are called xanthelasmas. And they're actually cholesterol deposits. When you take that off and send it to the lab, it's cholesterol in there.
How do you like that? Because some people would think, you know, I have a skin tag on my eyelid and not think anything of it.
You're 100% correct, Michelle.
Wow.
That's what they say.
Okay, diabetes is another one that you could see just by looking into your eyes for an exam. What are you looking for there?
Absolutely. On the inside, what you're seeing are leaky blood vessels in the eye. And if you have had diabetes for 10 years, 80% of those people are going to have eye changes, and we call it diabetic retinopathy. Here we have a picture. On the left is a normal. When I put on like this, it's called a coal miner hat. No, really, it's called an indirect ophthalmoscope. And when
I can see why you call it a coal miner hat.
So when we go mining in your eye, we can see the retina, which is like the film in the camera of the eye. And on the left is what a normal retina would look like, kind of orange, like a tomato. And over on the right, you see all these little leaky blood vessels, and the little white spots are called exudate, where it's a sign of injury to the eye. And big things can happen, like bleeding in front of the eye. If you're a diabetic, you can suddenly have your vision go all the way out because the eye's full of blood.
My goodness, that is incredible that you can see it in so much detail too. And brain trauma, I mean, that was something that really struck me because, you know, it's your eyes are what your brain is focusing on, right? We're giving our brain information.
Exactly.
So what can you see when you do your exam? Is it similar to the diabetes?
Well, it's different because sometimes we see pupils that are asymmetric. That's what usually starts with. Like here, we have like one pupil that's bigger than the other. And the first question, Michelle, you want to ask is, which is the normal? Is the one too big or is the one too small? You know, which is the normal size?
Now, if this is you and you notice, would you notice this in the mirror, or do your eyes have to be dilated at the office?
Very good question. No, ma'am. If you see this, if normally your eyes have been fine, your pupils have been symmetric, and by the way, 20% of people will have just a little asymmetry. So if you have always noticed that one pupil's a little bit tinier than the other, then don't panic because that could just be you. But if there's a news change, then you want to call your doctor that day, and they'll ask you questions like, have you had a head trauma? Are you having nausea and vomiting? You know, are you having double vision? Because you could have something very, very serious like a brain tumor, like an aneurysm, or it could be something very benign. So don't hit the panic button, but call.
Right, but pay attention.
Absolutely.
Is what you're saying. Yeah, don't discard it. So, and high blood pressure is another one.
Yes, high blood pressure, you know, there's constriction around the vessels everywhere when we have high blood pressure. And so you can get constriction in the vessels of the eye. And it's interesting because if you see changes, again, in the retina, which is like the film and the camera of the eye, if you see those changes, you are 4 times more likely to have either a heart attack or a stroke.
What?
So,
Wow.
yeah. And
4 times more likely. That is
isn't that
incredible.
crazy? When I was in training, I had a very older gentleman who hadn't been to see a doctor in years. His eye looked terrible. He had like real bad changes in the retina, and he had never had his blood pressure checked. It was through the roof.
Dr. Fitch, thank you so much for being here. We really appreciate it.
Thank
Listen,
you.
if you are over the age of 40, you have to go see your eye doctor. Stop putting it off,
Absolutely.
right?
Thank you.
We're going to
Thank
have
you.
all of these tips also on our website on the BMA page of CBS46.com. Jen, isn't that incredible? All of these conditions you could find out.
That was super fascinating. Seriously, I loved that
Thanks for having
segment.
me.
So much you can know through